So Sacituzumab Govitecan is an antibody-drug conjugate. The target of the antibody is called TROP2. TROP2 is a cell surface antigen that's present on the majority of epithelial tumors. That includes urothelial carcinoma, where it's overexpressed, particularly in invasive urothelial carcinomas. The study started off as an overall basket study, a dose escalation phase 1 basket study, with a number of different tumor types that included urothelial carcinoma. And in that phase 1 portion of the study, which is now published, it was determined that myelosuppression was the dose-limiting toxicity, and the recommended phase 2 dose was 10 milligrams per kilogram given on a day 1, day 8, Q21 day schedule. There was this early signal of activity in urothelial carcinoma patients, which has been published. So we performed a phase 2 expansion study, and that's what was presented at this conference. We enrolled 45 patients with advanced treatment refractory urothelial carcinoma. They had measurable disease and an ECOG performance status of 0 or 1. The primary endpoint of the study was objective response rate measured by RECIST 1.1. And we also looked at duration of response, progression-free survival, and overall survival, as well as tolerability and adverse events. So those 45 patients that were enrolled, they received a median of 2 prior lines of therapy, but up to 6. A subset of them also received immune checkpoint inhibitors. The study went over a number of years. It was only open for about 7 weeks post the approval of the first immune checkpoint inhibitor in the United States. So it was only a subset that received that. That being said, for that heavily pretreated patient population, that was about 3/4 with visceral disease, 1/3 that have liver metastasis. Overall, I would say the summary is that it looked good. So the objective response rate was confirmed at 31.1%, and that was maintained more or less amongst the different subsets, including 1/3 of the patients with liver metastasis had objective responses. That was at the cost of some moderate toxicity, but not a lot of high-grade toxicity. So the only grade 3 to 4 toxicities that happened in at least 10% of patients were laboratory toxicities. There was 9% incidence of diarrhea and fatigue at a grade 3 level. There were also grade 1 and grade 2. There was 38% grade 3 and grade 4 neutropenia, but only 7% had febrile neutropenia. 5 patients came off for potentially drug-related toxicity, but none due to neutropenia, and there were no treatment-related deaths. So in that setting of a treatment refractory patient population, that objective response rate is pretty impressive compared to historical controls. That those that responded, the duration of response was a median of 12.9 months. So most of the patients that responded, number 1, had a response that lasted more than a year, and number 2, they were able to tolerate drug for more than a year. The onset of response was most often at the first scan. The median time to onset of response was 1.9 months, but a few patients responded later, including one that responded after 7 months. For the overall population, those that responded as well as those that didn't respond, the median progression-free survival was over 7 months, with an overall survival over 16 months. Again, both overall compared to historical controls, because this was not a randomized study, pretty impressive. So I would sum up to saying that the combination of what we see in terms of efficacy as well as the tolerability is very promising, and that led us to launch a larger, more confirmatory study called the Trophy U01 study. That study has been activated. We are still opening new sites, so it's still relatively early, but it's anticipated that we're going to finish enrollment hopefully by the end of the year. The primary cohort that we'll be looking at is 100 evaluable patients that have metastatic urothelial carcinoma and progression despite platinum-based chemotherapy and a PD-1 or PD-L1 immune checkpoint inhibitor, with no limit of lines of therapy. Again, looking at the objective response rate as well as tolerability. There'll be an exploratory cohort looking at those that are cisplatin ineligible that have also had cancer progression despite prior immune checkpoint inhibitors.